Parkdale Queen West Community Health Centre is a community-based organization providing a range of primary health care, community health services, social care services for a group of people in our communities that have been structurally marginalized and excluded from accessing dignified care and high-quality care. We also see community members who live in the neighborhood, who are homeowners, who are renters, folks who have other kinds of stability in their lives, but who see value in getting their care in an organization that is fullness in its inclusivity.
We provide ongoing primary care, chronic disease management, harm reduction, acute and episodic care, all life stages, all ages. We're a group of RNs, NPs, and physicians that function as a team so that our clients always have access, especially if they need something urgently or need to be seen urgently. In addition to our sort of general primary care, there's a dental team that offers hygiene care and dental assessments, dental surgery if appropriate. We have a physiotherapist that works with us who we can refer to. We have a diabetes team that's here to support us as well and improve people's outcomes. We often serve clients who experience barriers or have had difficult experiences with the healthcare system, are often marginalized in some way, or have difficulty accessing care in a more mainstream model.
Did you have to get special training to drive this?
No.
Or just practiced?
No. It's what I've been telling the team is that
the concept behind the mobile bus is that we would go to where people are at, provide primary care where they're living, so in the shelter, in the encampment, in different housing places, different drop-in areas where people might be going already. I like the mobile bus because it aligns with my values in terms of leading with harm reduction, leading with patient-centered care in all ways, and trying to address the social determinants of health, like right at the need, right at the source, I guess, is more what I mean. I like that I can provide care in a really low barrier way. So like a lot of the clients I work with are not able to make like an appointment time, but they know that I'm going to be at their residence between kind of 1 and 4, and they can drop in at that time, or they can text me and say, "Are you here?" And they can, ask me. It's a little bit more fluid.
I appreciate the harm reduction approach that we all take to the care we provide, the services that we offer and the wraparound care that exists here that doesn't exist in a lot of other places, and the team-based model that we use. There's a lot that we're able to do for them under one roof, and I think that means a lot to people, that they can build many relationships here, and they don't just know one person, they can know lots of people in the building, and this is a safe space for them to come.
Hi. Hi, Mama. The 5-piece program is one of our health promotion programs at Parkdale Queen West. It's hybrid. which means we live stream it, so you can choose if you'd like to come in person or if you'd like to join us online on Zoom. There's toys, there's mats, there's babies. We sing, we laugh, we chat, and we also have guest speakers, and we talk about child development, health and wellness.
What's going on? What's going on?
It's my first pregnancy.
She's like, is the program gonna start?
It's like, where are the toys?
The 5 Ps, you know, it helped me with dietitians, with lactation consultants, with just people who were there for me during the pregnancy. I was pregnant twice before and lost the baby.
Hey, Mama.
Counseling is super helpful. My counselor is very knowledgeable in postpartum. She makes me feel like everything that I'm saying, no matter how crazy it sounds, is legitimate. It just makes me feel sane. It's very important as a new mom to be connected to a program, to a place that has other moms that are going through what you're going through. I wish that every single mom takes advantage of this program and comes while they're pregnant, after they give birth, because it is so essential. It is crucial, like it's crucial.
There's lots of newcomers come to our program, lots of teens and youth who are parenting, parents who have current or past substance use, parents who have self-identified mental health, challenged with mental health. I think it's really important work, and it's important that we're connecting people to the supports and things that they want so that they can have a good life.
Oftentimes we think about healthcare and we think about primary care, we think about the physicalities of our bodies and the illnesses that we might be living with, and mental health challenges are a part of that as well. Folks are living with multiple mental health diagnoses, with trauma, with experiences of poverty and challenges with substance use, whatever they might be living with. Those also impact people's physical health, and I think in viewing health holistically, we also need to take into consideration our minds and our emotional experiences.
And how old is Richie now?
15. Yeah.
That doesn't even seem possible.
I know, right? Time
Remember when you were
flies.
pregnant with them?
Yeah.
You just have one?
No, I have 2.
No.
2 and a third.
Yeah.
One of the beauties of community mental health is that it doesn't have to look one way, and that we are really committed to supporting people in the ways that meet their needs. Some people don't feel comfortable coming to this space, so it'll mean going out, meeting them in community, going for a walk and having that conversation. Mental health services, counseling and case management aren't a service unto themselves. They are really connected to and embedded in all of the programs at Parkdale Queen West. So they are a part of harm reduction, they're a part of primary care, they're a part of the health promotion programs. We're all working in this organization together to create stronger health outcomes, stronger physical, mental health, community connections, all of these pieces together.
In Parkdale Queen West Community Health Centre, we are deliberate in working in a way to ensure that the full diversity of the communities that we live in, the full diversity of who needs care, the full diversity of those folks who experience what I call structural marginalization, that they see that door of the health center and the many doors that we have as doors that they can open.
Health has always been the most powerful pillar of an Anishinaabe people because we had just the most extreme, really well health in our communities from time immemorial, which was disrupted, of course, by colonization. The Niwin program has evolved since I've been here to be culturally relevant and specific to all the indigenous populations. We have Inuit, Métis, Dene people, all tribes coming here to learn and foster their indigenous knowledge and who they are. Who they are is very important. Who we are. Because the health center itself is well known for the harm reduction philosophy. While our council sat and looked at what that meant for the Niwin program, and it took them a year to come up with a beautiful legacy of that ethic of non-interference teaching that was given to our people many moons ago. We already had that component in place of allowing people to journey and experience life on their own. So that whole harm reduction definition is a little bit different for us. We don't just walk. We don't just meet the people where they're at. We actually walk with them and empower them to be beautiful spirit beings on a human journey. And that's what the program is about.
We as an organization prioritize serving people who use drugs. Right now, there are policy changes, there are programmatic changes, there are philosophical approaches that governments in Ontario, and I would say broadly across Canada, are taking that would seek to erase core services that we provide that we call a continuum of harm reduction services. So the greatest challenge right now for me is that harm reduction services that we provide and that we see as essential and life-saving is under threat.
This is the place where the people who use drugs, they come over here for grabbing like any harm reduction supplies or kits, naloxone kits, hygiene supplies, worm supplies like clothing things. Also, this is a place where we can connect them with other services, other programs, both internally and externally. Like internally, we have a safe consumption site here, so we can refer them there if anybody want to use that site. And also we do drug checking services here, so they can know what are the other drugs are mixed up with their expected drugs. So to use their drugs safely.
So this is the client's space for the time that they're using the consumption space. And there's a mirror here if they need it. There's sharps containers, little garbage can, and this space is private for them to use. They can sit. Often clients in this space connect with staff with other issues that they might be having in their life. Some are substance-related issues, some are health issues, some are legal issues, and this is where clients engage with the staff depending on what their needs are. And we can really offer a lot of support in many areas.
I originally went to the Queen West site a little over a year ago. I went in that site just to use safely. At that point, I'd been homeless for a couple months. I had lost custodial access to my kids. and I was facing Christmas out on the street last year.
Okay.
You get this beautiful stuff.
Yeah.
It's very red and makes you very dry.
Kevin, if you'd like,
Yeah, I'll hold that for
you can hold that because we're short of a reclining chair. We got a comfortable spot, but try and dry that wound up a little bit.
Yeah.
Excellent.
Let's get that crud out.
I'm getting some counseling for, losing your home, losing access to your kids, all those things are terribly traumatic experiences. You have to unpack that stuff and you have to deal with it at some point or it comes back and it bites you. And I'm getting some support in that regard, thanks to staff here. And it's really been an extraordinary amount of care that I've received and a lot of help. And they've never, ever once overlooked my agency and my autonomy in that and my essential humanity. I'm still a person here. And being an addict is one of the most dehumanizing things that will ever happen to you.
And just put that lovely dressing right on there for you.
Thank you very much.
You're welcome.
The staff really come from a lens of reducing the harms as well as a trauma-informed approach. When you're tired and you're hungry and you're sick, and before you have to go stand in line at a walk-in clinic or go to an emergency room, there's the SCS. And it's there, and it's an entry into good quality healthcare when you're ready.
It's not a drug den, and it's very offensive to suggest that it is. This is a place where people go to keep alive. Harm reduction is a modality of treatment that aims to keep people like me alive and reasonably intact for as well as it can until we're in a place where we're ready to deal with whatever it is that we need to deal with to get through our addictions. Community means that everyone there is a member of that community, whether we understand what they're going through or not. I feel very much a part of this community, Parkdale Queen West Community Health Center. We're not all riding in the same boat necessarily, but we're all rowing away trying to get to a better place.
We all work in the same place and we all know each other. We're sort of all aware of a client's stories. They don't have to answer the same questions every time. Everybody's on the same page. And I think it leads to just more comprehensive care in general. And people don't fall through the cracks.
Folks who come to work in this organization are very much values driven. Their act of social change, their act of activism is through their work. And I'm proud that I have been in an organization that enables that to happen. I'm also proud that the communities who we want to serve, communities who are structurally marginalized, trust this organization to give them good care.